Hi, everyone, and welcome to the Truth About Psychiatry. This is video number 14, and today I would like to talk about the therapeutic state. This is what Szasz wrote about frequently, Thomas Szasz, in his books and his articles, is that psychiatry, um, besides being a pseudoscientific system of slavery that masquerades as a medical profession, it is also an arm of what Szasz often referred to as the therapeutic state, which is sort of a new form of totalitarianism. Um, it's recognizable in other regimes such as Nazi Germany, Soviet Russia, um, and Szasz has a lot to say about both of those regimes and the similarities of psychiatry in all of those regimes. Um, so, to lead into a discussion of the therapeutic state, there are a couple of books by Thomas Szasz that I would like to discuss, and I'd also like to begin with a couple of quotations that I think will be useful to keep in mind as we're thinking about what the therapeutic state is, and why and how psychiatry fits into that, and why it's so tyrannical. So, um, as I was reading through some of my notes on these books, a couple of quotations came to mind. One is one of my favorites from Ezra Taft Benson, a former prophet of the Church of Jesus Christ of Latter-day Saints, former president of the Church of Jesus Christ of Latter-day Saints. And he had something that I think goes to the heart of the matter, in opposition to, well, that goes to the heart of matter and shows the opposite, the true Reformation in juxtaposition to the way that psychiatry, psychology, the therapeutic state, and lots of things, lots of man-made methods fit into this juxtaposition of how the Lord works versus how the state works, or psychiatry works, or other things like that. So this is what he had to say. Quote, "The Lord works from the inside out. The world works from the outside in. The world would take people out of the slums. Christ would take the slums out of people, and then they would take themselves out of the slums. The world would mold men by changing their environment. Christ changes men, who then change their environment. The world would shape human behavior, but Christ can change human nature." I love that quote because that's how the Lord works, is changing us, changing our hearts from the inside, through His love, through His sacrifice. And that's an internal change that is available to everyone who comes unto Christ and will repent and change. And it stands in stark contrast, and it's an invitation, and people are free to choose to come unto Christ. They're free to choose to repent, and they're free to reject that invitation. And all of that works in direct opposition to, like I said, how the state, psychiatry, things that work from the outside in, trying to change human behavior from the outside. And I think it was Edmund Burke, I think I might have mentioned this before, he has something to say about the less, well, let me just look it up real quick, because it pertains to what we're going to talk about with psychiatry. Chains, moral appetites, moral something, let's see, here we go. So, men are qualified for civil liberty in exact proportion to their disposition to put moral chains upon their own appetites. So this would tie in with Benson's "The Lord works from the inside out." people choosing to put moral chains on their own appetites. In proportion as they are more disposed to listen to the counsels of the wise and good in preference to the flattery of knaves, society cannot exist unless a controlling power upon will and appetite be placed somewhere, and the less of it there is within, the more there must be without. It is ordained in the eternal constitution of things that men of intemperate minds cannot be free, their passions forge their fetters. So this is just an argument for a virtuous society. Without virtue in a society, there will have to be some sort of, since there won't be chains on the moral appetites, or moral chains on the appetites, there will have to be controlling power from without, which all of this contributes to the rise of totalitarian regimes and to 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 pressures for change from the outside. Man, that just reminded me of another quote. If I can find it real quick, because it ties into that as well. So from a former apostle, Elder Neal A. Maxwell, um, um, about, let's see, about how the lack of internal control that leads to more external control by government force and so forth. If I can find it, I know the general idea. Basically, about something about playing God. Gosh, I don't know if I'm going to be able to find it quickly enough. So I'll have to look that up later, but basically the same idea that there's a lot of people that are going to be very eager to swoop into that vacuum that's left behind by lack of virtue or lack of moral chains on the appetites. And the less of that is within, the more will be without, and there will be many people. And psychiatry is a good example of that, of what swoops into as the external force. And it's not always because there's not internal control or change going on. It's just that it's psychiatry is just very aggressive that way. So there's a couple quotes. Also, I thought of C.S. Lewis. He has an essay called "The Humanitarian Theory of Punishment." I recommend the whole essay to you. It's very prescient, and Lewis understood what I think, and all this pertains, I think, to what we're seeing with the Wuhan virus, the response to the Wuhan virus. So here it is, a passage from The Humanitarian Theory of Punishment. C.S. Lewis, quote, "And when they are wicked, the humanitarian theory of punishment will put it in their hands a finer instrument of tyranny than wickedness ever had before. For if crime and disease are to be regarded as the same thing, it follows that any state of mind which our masters choose to call disease can be treated as a crime and compulsorily cured. It will be vain to plead that states of mind which displease government need not always involve moral turpitude, and do not therefore always deserve forfeiture of liberty. For our masters will not be using the concepts of desert and punishment, but those of disease and cure. We know that one school of psychology already regards religion as a neurosis. When this particular neurosis becomes inconvenient to government, what is to hinder government from proceeding to cure it? Such cure will, of course, be compulsory. But under the humanitarian theory, it will not be called by the shocking name of persecution. No one will blame us for being Christian. No one will hate us. No one will revile us. And this is the key passage. The new Nero will approach us with the silky manners of a doctor, and though all will be in fact as compulsory as the tunica molesta or Smithfield or Tyburn, all will go on within the unemotional therapeutic sphere where words like right and wrong or freedom and slavery are never heard. And thus, when the command is given, every prominent Christian in the land may vanish overnight into institutions for the treatment of the ideologically unsound. And it will rest with the expert gaolers to say when, if ever, they are to re-emerge. But it will not be persecution. Even if the treatment is painful, even if it is lifelong, even if it is fatal, that will be only a regrettable accident. The intention was purely therapeutic. Even in ordinary medicine, there were painful operations and fatal operations. So in this, but because they are treatment, not punishment, they can be criticized only by fellow experts and on technical grounds, never by men as men and on grounds of justice. So the new Nero will approach us with the silky manners of a doctor. And so all of this treatment for the ideologically unsound will be conducted in the name of therapy, in the name of humanitarianism, and ostensibly for the good of the person who is being treated. So C.S. Lewis was prescient in this, and his mention of the therapeutic ties into, of course, Thomas Szasz' concept of the therapeutic state. And this therapeutic state has been growing for quite some time. So Thomas Szasz wrote a book called Pharmacracy, Medicine and Politics in America. This guy right here. And I would like to introduce you to this book, and maybe in connection with those previous thoughts, we'll think about also what's going on presently with the Wuhan virus and the reaction of the state to this pandemic. So I write, I have a new favorite book by Thomas Szasz. Pharmacracy, Medicine and Politics in America is a tour de force of philosophical, political, and moral insight. Moreover, it is a delight to read. Szasz' thesis in this book is simple and straightforward. Pharmacracy, Szasz argues, is political rule legitimized and enforced by experts on diseases and drugs. The pharmakoi, much as democracy, is political rule legitimized and enforced by the will of the people, the demos. Szasz drew inspiration for the title from Alexis de Tocqueville's Democracy in America, and he aimed to demonstrate how pharmacracy now dominates American life. Pharmacracy, Szasz writes, exhibits the following characteristics: the transfer of authority for defining disease and treatment from physician to politician, the deliberate blurring of boundaries between disease and non-disease, between the medical treatment of disease and the use of medical personnel or medical technology to alter non-disease, the severing of the contractual economic relationship between the physician who delivers medical care and the patient who receives it. The basic problem that Szasz so clearly understands and articulates is that the modern therapeutic state, a term that Szasz proposed in 1963, emerged from the tyranny of healthcare that masquerades as benevolent medicine. Quote, making the physician an agent of the state or of a third party controlled by the state and exempting the patient from financial and personal responsibility for caring for his own health are bound to have far-reaching and undesirable consequences for both parties as well as for society. This indeed has been the experience in every country that has nationalized health service. So I'm seeing a connection here already with Benson. Obviously, Ezra Taft Benson was talking about spirituality, about internal change in terms of spiritual rebirth. But Szasz here, he's obviously talking about health, and where Benson was saying, you know, the individual is in charge of choosing to invite that change from Christ internally. I would say similarly, Szasz is saying that the individual is in charge of his health, and that can't be delegated to someone else. Szasz has an incredible knack for encapsulating his thesis in pithy and memorable prose. People have always longed for universal health care, and rulers have always supplied them with this service, or more precisely, with a policy that the ruled accepted as such a service. In the Middle Ages, as the ruled accepted as such a service. In the Middle Ages, universal health care was called Catholicism. In the 20th century, it was called communism. In the 21st century, it is called universal health insurance. So Szasz is being provocative there, and I mentioned that I disagree with a lot of his observations on religion, because he was an atheist and didn't quite understand some important spiritual things. But I think what he has to say about questioning the necessity and efficacy of universal health care is something that he did well. His insights regarding the modern healthcare system are well worth pondering. Quote, "Everyone complains about the direction in which our healthcare system is heading, yet no one wants to recognize the two major sources of the problem: the medicalization of everyday life, that we talked about in the last video, and the fundamentally unsound character of the system by which we pay for medical services. The cost of the care increases relentlessly while its quality declines. More and more patients are dissatisfied with their care, and more doctors are unhappy about practicing medicine. As long as the medicalization of everyday life continues, this trend cannot be reversed." Furthermore, Szasz draws upon a capacious knowledge of Western literature, philosophy, and science. He cites Plato, Aristotle, and Cicero with the same facility that he cites French playwrights, Russian novelists, and Mark Twain. His grasp of medical and scientific literature is no less impressive. In this volume, Szasz devotes particular attention to the theories of Rudolf Virchow, who we've talked about in previous videos, the father of modern pathology. Each of his sources contributes to the aim of this book, namely, quote, "to show that the effort to medicalize life is not only cognitively ill-conceived, it is also politically perilous. Conflict," Szasz continues, "is intrinsic to human existence. Regulating disagreements as if they were diseases is a recipe for forfeiting liberty in pursuit of an illusory therapeutic paradise on earth." So that last point, regulating disagreements as if they were diseases, recipe for forfeiting liberty. So I think that is sometimes what we have in mind when we think of healthcare. It's the pursuit of an illusory therapeutic paradise on earth. Even in this Wuhan virus, it's not to say there's not a real virus. It's not to say that it's not dangerous and that we should be careful not to be infected or infect others. But it's a lot of the discourse seems to revolve around this idea that what we're trying to build is this illusory therapeutic paradise on earth, which is not at all what the founding fathers had in mind, and I don't think it's even something really worth aiming towards. Szasz begins this book with an inquiry on disease. He starts with a simple Socratic question: what is disease? What follows is a stimulating survey of medical history and a trenchant analysis of the word itself. Szasz concludes that, quote, "virtually every wrenching personal experience and socially undesirable behavior is being diagnosed as a disease and discovered to be treatable by an intervention classified as healthcare. Szasz is careful to distinguish between scientific medicine, whose object and study are diseases that affect human beings, and clinical medicine, whose objects of study are persons, usually called patients. This distinction is important because scientists undertake to understand the nature of disease or what disease is, whereas clinicians view people through the lens of diagnosis and treatment. Diagnosis, it turns out, is the currency of the therapeutic state. And that's what I see now with the Wuhan virus, turning to our virologists and immunologists and scientists, the experts, the clinicians, and even fellow citizens that are starting to simply view people through the lens of diagnosis and treatment, or viewing people rather than seeing human beings as dignified moral agents or children of God. They're just a clump of cells that, a potential walking virus carrier. So this lens of, I think, the therapeutic state just magnifies this this view of people. Quote, emperors, dictators, and democratic governments alike finance wars by creating excess money, that is, by monetary inflation. Similarly, therapeutic states finance their wars on mental illness, drugs, and other bad habits or unwanted behaviors by diagnostic inflation. During the past 20 years, numerous authors and publications in professional journals and the popular press alike have criticized and ridiculed one or other aspect of the medicalization of life, without, however, telling us what they regard as the objective standard of disease. The Szasz wanted to get really clear on what disease really means and to separate it from the metaphorical uses of disease that the therapeutic state employs to increase its own power and to really, for, like, you think about who profits from the therapeutic state, who profits from the continuing expansion of so-called diagnostic categories. Certainly not the individual citizens. So, continuing on, in Pharmacracy, Szasz devotes a chapter to the problematic concept of disability before delving deeper into psychiatric medicine, philosophical medicine, and political medicine. So yeah, that's an interesting chapter. Check it out if you're interested. On even the way we talk about disability is, I think Szasz says, is informed by the therapeutic state. So these chapters on psychiatric medicine, philosophical medicine, political medicine, these are his richest chapters, and I'll share a few more passages to whet your appetite to read this book. If we count discomforts and deviances as diseases, we change the criterion for what counts as a disease and set the ground for steadily expanding the category called disease. Patients suffering from discomforts can classify their feelings of malaise, and diseases can try to convince others to accept their claims. Many prominent persons now engage in this kind of disease promotion. Some advertise their depression as brain disease, others their impotence as ED, erectile dysfunction. Still others their former drug use from which they are in recovery. Physicians and politicians can do the same with other people's deviance. Because physicians and politicians regularly function as agents of the therapeutic state, this is an ominous development. Acting in concert, they possess the power needed to convince, coerce, co-opt, or corrupt the public to accept the illness inflation they promote. Quote, practicing physicians, especially family doctors, must at least provisionally accept their patient's complaint of pain, malaise, fatigue, and insomnia at face value, as if they were the symptoms of disease. Worse, they are under duress to prescribe chemically active drugs for them, regardless of whether the patients have demonstrable diseases or, if they have such diseases, whether the prescribed treatment is effective, trying to make patients believe that something is being done for them. Physicians feel compelled not only to treat many non-diseases as if they were diseases, but to justify doing so by medicalizing the patient's complaints and establishing pseudoscientific accounts of their ailments in medical journals. Let us be honest, classifying non-diseases as diseases serves the economic, existential, and professional interests of the classifiers and is, to boot, socially expected of them. So this made me think a similar thing, the way that we talk about the Wuhan virus, now we're talking about coronavirus and we're talking about COVID-19. How does the way that we talk about it serve the economic, existential, and professional interests of the elite class, the experts and also the media that's disseminating this information? For the vast majority of healthcare professionals, especially the legions of psychologists, social workers, grief counselors, drug abuse specialists, and other practitioners of existential cannibalism, it would be professional suicide to categorize non-diseases correctly. If their every instinct of self-interest opposes such truth-telling. After incessantly inflating the concept of illness, medical professionals and the media have in effect lost their ability to call a spade and a heart a non-spade. Confronted with sufficient pressure from individuals, institutions, and the state, they are too confused or timid to call phenomena that lack the requisite features of diseases non-diseases. So obviously the difference with the Wuhan virus is that it's an actual virus, it's actual disease, COVID-19 as it's called, as distinct from the fake diseases of psychiatry and the ever-expanding diagnostic criteria. But it's still being used in the therapeutic state. The combination of medicine and politics, or what Szasz calls pharmacracy, it serves the economic, existential, and professional interests, not of the people, not of the vast majority of people who are to whom this information is disseminated, but it serves the interests, as Szasz says, their every instinct of self-interest opposes such truth-telling. So I think a very similar thing is going on. Watching Anthony Fauci, Dr. Fauci, and then our local government officials combined with the therapeutic experts that we're all supposed to obey. Coercion masquerading as medical treatment is the bedrock of political medicine. Long before the Nazis rose to power, physician eugenicists advocated killing certain ill or disabled persons as a form of treatment for both patient and society. What transforms coercion into therapy? Physicians diagnosing the subject's condition as a disease, declaring the intervention they impose on the victim a treatment, and legislators and judges ratifying these categories as diseases and treatments. Simply put, the pharmacrat's stock in trade is denying the differences between medical care sought by the patients and imposed upon them against their will. In short, defining violence as beneficence. So violence as beneficence also makes me think of our one of the chief, I think, members of the therapeutic ruling class, Bill Gates, that his beneficent desire to see that all are vaccinated, and it's all, it's all for the good of there, and it's not there's not any thought of choice involved by people who it's supposed to be imposed upon people for their own good because they're experts, that ostensibly are working for the common good, but I'm highly skeptical that that's actually the case. Quote, after vanquishing the two 20th century statisms, National Socialism and Communism, we are sacrificing our freedom on the altar of the most Catholic and democratic of all modern statisms, the ideology of pharmacracy embodied in the therapeutic state guaranteeing every man, woman, and child a right to health care. Please read the entire book. You won't be disappointed. There might be a few more passages. Szasz is, like I said, he's pulling out quotes from Tocqueville, from Molière, from Jules Romain, there's a satirical play called Knock that I really want to read. I haven't read it yet, but it apparently is a good example of how the therapeutic state works. And so he's always got a lot of great literary support to his arguments. Talks about virtue, the concept of disease. And the therapeutic state. I know there was some passage in here that I really wanted to share with you. It quotes G.K. Chesterton. The madman, G.K. Chesterton put it so memorably, is not the man who has lost his reason. The madman is the man who has lost everything except his reason. Yeah. So, there's also a lot on what was happening in Nazi Germany, and how psychiatry. We've talked about this in previous videos, but Szasz shows how the therapeutic state worked in Nazi Germany. This is good. In the aftermath of World War II, stimulated partly by accounts of medical atrocities in Nazi Germany, partly by accounts of psychiatric atrocities in insane asylums at home, and partly by the medical social problems associated with abortion and homosexuality, there suddenly emerged a new branch of academic inquiry called medical ethics. With great speed, medical ethicists established their own journals and proceeded to generate a vast literature, much of it devoted to justifying various medical interventions considered controversial. Almost overnight, medical ethics became a prestigious academic and medical discipline and a widely discussed topic in the popular press. Most medical ethicists were and are philosophers, theologians, and physicians, a disproportionately large number of the latter being psychiatrists. The status of psychiatry as a medical specialty is marginal at best. Psychiatrists have a long history of violating basic human rights. Hence, the dominant role of psychiatrists in medical ethics casts a moral shadow over the field. The ethics of medical ethics is further jeopardized by the fact that much of the work is done by agents of the government or by professionals whose careers depend on grants from government agencies, often the National Institute of Mental Health, NIM. We talked about the secret of NIM. The influence of that government agency on medical ethics and psychiatry has not received the attention it deserves. The very existence of the NIM implies that mental diseases exist. Or to use a different analogy, as the existence of the Vatican is premised on the legitimacy of theological authority, so the existence of the NIM is premised on the legitimacy of psychiatric authority. The situation has virtually precluded unbiased philosophical inquiry into the ethics of psychiatry and has contaminated all of medical ethics. He quotes Mortimer Adler. Mortimer Adler, very clear thinker, said, It is clear that in the strict meaning of disease, only the body can suffer lesions. The intellect as such cannot be diseased, though it can be affected by a diseased body. Abnormalities, which are not strictly diseases, are the result of habit formation, contrary to the norms of good conduct, in other words, vicious characters. And Szasz says, today this view is considered outmoded, and the language which Adler has cast is excoriated as lacking in compassion. So there's Mortimer Adler speaking truth, and Szasz defending truth. So here's a clarifying paragraph from Szasz. When I say that mental illness is not an illness, I do not deny the reality of behaviors to which the term points, or the existence of the people who exhibit them, the suffering the denominated patients may experience, or the problems they create for their families. I merely classify the phenomena people call mental illness differently than do those who think they are diseases. When a lesion can be demonstrated, physicians speak of bodily illnesses. When none can be demonstrated, perhaps because none exists, but when physicians and others nevertheless want to treat the problem as a disease, they speak of mental illnesses. The term mental illness is a semantic strategy for medicalizing economic, moral, personal, political, and social problems. And I agree with Szasz there. Szasz quotes C.S. Lewis again, of all tyrannies, a tyranny sincerely exercised for the good of its victims may be the most oppressive. To be cured against one's will and cured of states which we may not even regard as disease is to be put on a level with those who have not yet reached the age of reason, or those who never will, to be classified with infants, imbeciles, and domestic animals. Lord Acton, the medicalization of politics. See if there's anything else. The metaphor of war. People are always talking about the war against this, the war against cancer, the war against drugs, the war against the invisible enemy, the war against coronavirus. So, this is good, and I thought of when I read this passage, I thought immediately of what's happening with the Wuhan virus. That, let's see. To understand our present dilemma, we must understand the growth of the American state, especially since the Roosevelt years. This was a period during which the United States became a complex, bureaucratic, regulatory welfare state, a condition brought about by means of the time-honored political tactic of declaring a national emergency, requiring that all of the state's human resources be mobilized. Every collective revolution, warned Herbert Hoover, quote, rides in on a Trojan horse of emergency. It was the tactic of Lenin, Hitler, and Mussolini. This technique of creating emergency is the greatest achievement that demagoguery attains. The infamous Georges-Jacques Danton, French Revolution, declared everything belongs to the fatherland when the fatherland is in danger. 2 years later, the fatherland repossessed his head. To the executioner about to guillotine him, he said, "Show my head to the people." So there's a member of the therapeutic state, of the therapeutic leaders that became a victim of the very therapeutic state that he defended. So yeah, Szasz even has commentary about the founding, which I find really interesting as well. Coercion as treatment. Let's see. Okay, so he says explicitly about communism and Nazism. I want to emphasize here that I regard right-wing Nazism and left-wing communism not as two antagonistic political systems, but as two similar types of socialism, statism, one brown or national, the other red or international. Both kinds of statists were very successful in their efforts to undermine autonomy and destroy morality. The therapeutic state as a type of total state with a sacred and therefore unopposable mission is not a new historical phenomenon. The theological state, the Soviet state, and the Nazi state may be viewed as former incarnations of it. To illustrate and underscore the problems intrinsic to the alliance between modern medicine and the modern state, I shall briefly review the anatomy of National Socialist Germany as a type of the therapeutic state. And we've talked about this in a previous video. He goes through and shows the role of psychiatrists in Nazi Germany, Hitler's obsession with health and with the well-being of animals, so forth. Szasz also talks about how the Nazis would refer to Jews and other unwanted groups as vermin, as kind of bugs, as or as cancers. They would talk about it in these therapeutic metaphors. They wage this therapeutic war. And Szasz says, this is a crucial point. Once we begin to worship health as an all-pervasive good, a moral value that trumps all others, especially liberty, it becomes sanctified as a kind of secular holiness. This is something we talked about in previous videos. So, maybe one more. I like Szasz here. He says, clearly the leading cause of death is being alive. The therapeutic state thus swallows up everything human, on the seemingly rational ground that nothing falls outside the province of health and medicine, just as the theological state has swallowed up everything human. Lest it seem that I exaggerate the parallels between these two total states and the religious nature of the therapeutic state. So yeah, this is a key point, that it's not just a therapeutic state, the combination of medicine and the state, but pharmacracy is actually, there's a religious nature to it. And you see this as, if you don't adhere to this religion of the therapeutic state, then many people will see you as a heretic. Parallels between the two total states and the religious nature of the therapeutic state. Consider Vice President Al Gore's by no means atypical remarks offered at an address at Emory University, pledging to wage the war on cancer with renewed vigor. So he quotes Al Gore. So Szasz was, he was very alert to what politicians were doing. Al Gore, Hillary Clinton, Jimmy Carter, people who believe that it was their job to be the therapist in chief, as he calls it. Formerly, people rushed to embrace totalitarian states. Now they rush to embrace a therapeutic state. When they discover that the therapeutic state is about tyranny, not therapy, it'll be too late. He quotes Goethe. With astonishing prescience, Goethe anticipated such a humanistic medicalization of life. He wrote, quote, I believe that in the end humanitarianism will triumph, but I fear that at the same time the world will become a big hospital, each person acting as the other's humane nurse. And that's a good introduction to pharmacracy, medicine and politics in America. And I think we can see, especially with the Wuhan virus, how everything seems like a big hospital and everyone acting as the nurse to the other, or what C.S. Lewis called the omnipotent moral busybodies. Now the derogatory term being used is a Karen. And so, in connection with that, Medicine and Politics in America, Szasz has another great book, The Therapeutic State. So this is a collection of essays on psychiatry in the mirror of current events. Just a whole bunch of essays that all pertain to psychiatry, the therapeutic state, and examples, just showing examples of his thesis in real life. There's just so many of them, but this book I would recommend as well because Szasz was very politically active as well, and he saw so much of what psychiatry was doing on a political level, and there's so many examples in here of famous people who have been mistreated or abused in psychiatry. One, Tennessee Williams, the playwright, author. I didn't realize that his sister was lobotomized against her will. His mother was incarcerated in an insane asylum. He was subjected to psychiatric rehabilitation against his will. Just all sorts of stuff that he went through. Szasz writes about the poet Ezra Pound. Apparently, he was also detained and abused grossly by psychiatrists over a long period of time. There's even an essay where Szasz talks about Elvis Presley, who also apparently a lot of the drugs that Elvis Presley had access to were thanks to his doctor accomplices. Wow, there's a chapter, Psychiatrist as Accomplice. So there's lots of essays on psychiatry and politics. The case of John Hinckley, the man accused of shooting President Reagan, and how he got away with the insanity defense and how that's wrong. Szasz is highly critical of the so-called insanity defense. Chapter on Ezra Pound, as I mentioned. There's a chapter on the President Carter, Jimmy Carter and his wife, that I think is really interesting and maybe can help us to see now how the therapeutic state is continuing to grow through the presidency. But the Carters, let's see, with the election of Jimmy Carter, all this has changed. Here, for the first time in American history, a president, indeed a whole presidential family, really believed in mental health, just as they really believed in Jesus and being born twice. The upshot is a veritable psychiatric presidency, a fitting ornament for the therapeutic state. So Szasz always has to bring in religion and make fun of that, which is, I think, hurts his case. I don't think it's a smart move by him. But he paid attention to what Jimmy Carter and his wife were doing. It was her pet project to devote herself to so-called mental health. She thought that 50 million of her countrymen are in need of mental health services. So yeah, wow, she was an interesting. They had a passion for mental health, so-called mental health, and I think we can see with the Carter presidency how the therapeutic state is really blossoming. So it's from the time of Roosevelt to then to Jimmy Carter. But there's more on the presidency and psychiatry, and the use of psychiatry in politics. There's a whole section on psychiatry in the USSR and how Soviet psychiatry, the comparison with American psychiatry and Soviet psychiatry. He even quotes a lot of Russian authors, including Alexander Solzhenitsyn. And Solzhenitsyn wrote, "It is time to understand that imprisonment of sane persons in madhouses because they have minds of their own is spiritual murder, a variation on the gas chamber, and even more." But so Solzhenitsyn, author of Gulag Archipelago, Red Wheel, lots of other books, was a fierce opponent of the therapeutic state in Russia. So, let's see if there's anything else. Some more on Ezra Pound. Quotes George Orwell and Animal Farm. And let's see. More quote George Orwell. There's just so many great essays in this book, and so many examples in political history of how psychiatry operates in the therapeutic state. Elvis Presley, as I mentioned. So anyway, there's a lot in there, but the therapeutic state, psychiatry in the mirror of current events. If Szasz were alive today, he would be able to see so much more growth of the therapeutic state, and we're already beginning to see how the so-called mental health profession is taking advantage of the Wuhan virus. I think if as we watch things unfold, there's going to be more and more talk of the mental health crises that are caused by the Wuhan virus, and that will give greater incentive for the therapeutic state to swoop in to fill the vacuum where formerly people thought about taking care of their own health and thought about the internal change that we talked about at the beginning of this video. So just the reminder, as Benson said, the Lord works from the inside out, the world works from the outside in. The world would take people out of the slums. So the world would, with the therapeutic state, would really try to arrange everything with the Wuhan virus or with the mental health crisis that's coming. But Christ would take the slums out of the people, and then they would take themselves out of the slums. The world would mold men by changing their environment. Christ changes men, who then change their environment. The world would shape human behavior, but Christ can change human nature. So that's just a little bit on Thomas Szasz, pharmacracy, and the therapeutic state, and I will see you next time.